first technique we're going to do is repeated retraction and sitting. So the first thing we need to do is correct your posture to enable you to achieve your full range of movement. So if you can uncross your legs, keep your feet flat on the floor, your hips and knees at 90 degrees and your bum in contact with the back of the chair. I want you to bring your shoulders backwards so your shoulder blades are touching. And imagine I'm pulling string from the top of your head to straighten up your posture, so you might find your back comes slightly away from the back of the chair. I want you to look at it, concentrate on a spot in front of you in the mirror, and then place your hand underneath your chin. And this is going to be your marker. So if you slide your chin backwards and bring your head backwards to your end range, hold momentarily, and then come back to your natural resting position. And repeat this, so back to your full end range, hold momentarily, and then back to your natural resting position. And one more time. And then back. Perfect. And now from this exact same position in your upright posture, we're going to do repeated retraction, extension and sitting. So the exact same as before, bringing your head completely backwards to your end range, and then slowly and steadily tilting your head backwards as if to look skywards. And again, hold momentarily, and then slowly and carefully come out of that position to your natural resting position. And then again, bringing your head backwards to its end range, slowly and steadily tilt back, hold, and come forwards again into your natural position. And one more time. The next technique we're going to do is retraction, extension and supine lying. So I'm going to demonstrate this first. The first thing to do is lie on your back on the plinth, keeping your feet flat on the plinth with your knees bent. And then if you have a non-painful arm, use that one and bring it up to the back, so hollow between the plinth and the back of your neck, then slightly upward so that it's on the back of your head. Then using your feet and your other hand, I want you to come off the plinth, slide upwards so that your head, neck and shoulders are off the plinth, and then tilt your head backwards, holding on to it as far as possible, and when you've achieved your end range, let your hand come back and rest on your shoulder, hold momentarily, and then bring it back to the back of your head, and come up and push yourself back onto the plinth again, using your feet and your hand, and then let your head relax back down, and bring your arm down. So this next technique is repeated extension and lying. So I'm going to ask you to lie on your front on the plinth and place your hands underneath your shoulders like this, as if you're in a press-up position. So if you want to do that for me. So hands directly underneath your shoulders, and what I want you to do is raise the top half of your body upwards by straightening your arms and elbows fully, trying to keep your hips on the plinth, but if they come off slightly, that's alright, as long as your arms are fully straight. And then relax back down. And you're going to repeat this 2 more times. So again, fully straightening your elbows and arms to achieve full range, and relax back down. And one more time, and then relax back down. I'm going to ask you to do another 3 of these, but this time I'm going to apply some therapist overpressure. That's okay. Okay, so if you can straighten out your arms and elbows. Does that feel okay? And then relax back down. And then again, straighten up. And relax back down. And one more time. And relax back down. This technique is shift correction in standing, and the patient has a right-sided shift. So you can just bend your elbow.